Olympic medalist and former CU buff Jenny Simpson is reportedly showing encouraging improvement after collapsing at an event this week. The 39-year-old was pacing a mile group at an event Tuesday when she experienced a medical emergency, being treated with CPR and an AED. Our medical expert, Dr. Payal Kohli, joins us now, and a lot of people, hear about an elite athlete collapsing, and you immediately think, how could this happen to someone who's in impeccable shape?
It's interesting. As a cardiologist, we often see a condition called athlete's heart, because you can imagine that athletes that have a lot of vigorous exercise can actually cause structural changes to their heart. We know their heart rate tends to be lower, which means the heart can actually start to dilate because it holds more blood in between heartbeats because it's beating less often. We also know that athletes, based on studies, have a 2.8-fold higher risk of something called sudden cardiac death, which is what happened here. Suddenly the heart stops beating. Yes. And during vigorous exercise, that risk can go up to 17-fold higher for about the 30 minutes after. So as a cardiologist, the way we actually stress the heart is a stress test where we put them on a treadmill and see what happens. Because when you're exercising vigorously, your stress hormones are elevated, adrenaline, epinephrine, norepinephrine. Hemodynamically, you're pumping more blood harder and faster, right? I talked about the structural changes. And then you can also have electrolyte abnormalities and dehydration. So putting all that together on a substrate of someone who may have a condition that predisposes them for this. So not everybody who exercises vigorously is going to have a cardiac arrest, but we find sometimes in athletes we didn't know they had this condition, and then we end up seeing this.
What about, just breaking it down even more so to like the demographic? What are some of those risk factors? Who's most affected when it comes to the sudden cardiac death in athletes?
So we see men more than women. Now take this with a little grain of salt because there's a selection bias. There are more male athletes than female, but 90% of sudden cardiac deaths are in men, and the ratio of men to women is 9-to-1. We see it more in Black athletes, in fact, and we don't understand the reasons for why that is. And then there's certain types of sports that can make you more predisposed. So we see basketball, baseball, football, and then endurance athletes, such as in this case when you're long distance track running. Now we saw Damar Hamlin have his sudden cardiac death. That was obviously due to chest trauma. That's a condition called commotio cordis, where the heart is resetting and getting ready for the next beat, and you hit it on the chest at just the wrong time. And that can actually cause that electrical problem, that arrhythmia that can make it stop.
And so you said endurance athletes are very much in the group that this can happen to, but other than that, what else stands out about this story to you?
The really important thing that stands out here, and the reason she's talking to us today, is because she got CPR and an automated external defibrillator as soon as she collapsed. And so in a way, for athletes, we're watching them, our eyes are on them, so when we see them collapse, just like with Damar, we can start CPR. We know that out of 100 out-of-hospital cardiac arrests, 90 of them are going to die. Only 10 make it, but the 10 that make it are the ones that get timely CPR and that AED on them.
So if someone collapsed right in front of us, what do we do? What can you tell our audience right now?
So I want you guys to remember these things. I want you to burn them into your brain because this is going to happen to some of us, right? And you could save a life someday. So the very first thing is you put your phone on speakerphone and call 911. Then you check for responsiveness, and that means putting your finger under their nose to see if they're breathing, looking for chest rise, and then feeling the pulse. We talked about this before. Not just on the wrist, but also knowing how to feel it on the neck. And if you don't have a pulse or you don't have chest rise, they're not breathing, you start CPR. Now, where do you do CPR? As a reminder, you draw a line between the nipples and go just below that on the breastbone. You interlace your fingers and you use the butt of your hand, put it over the breastbone, and you're pushing down hard and fast. And that's 120 times a minute. So that's 1, 2, 3, and 4, and 5, and 6. So get that rhythm in your head. And you don't have to do rescue breathing, especially if it's a stranger. Then you send somebody to get an AED. That's what's going to reset that heart back to the normal rhythm. It's really easy to use. If you haven't seen our one here at 9 News, you guys need to find it. That's your homework assignment.
By the door.
Good. And you just stick it on someone.
The one that leads you to the hallway, right?
Okay.
Yes, exactly. And it tells you what to do. So you put the sticker on the chest, it analyzes the rhythm, tells you if shock is delivered or not. It's not going to shock you, so you don't need to worry. But those are the 4 steps you need to remember. You could save somebody's life.
All right. Very, very important information. Dr. Kohli, thank you.